Mastitis is right up there with cracked nipples when it comes to pain and discomfort, and if it's left untreated, can lead to further complications that will impact your ability to breastfeed your baby. So in this video, I'm just going to make sure that you understand exactly what causes mastitis, the things that you can do to prevent it, and then signs and symptoms so that you know how to treat it effectively and early. This image is very typical of a breast that has mastitis because you can see that there's a very definite area that is red and inflamed, and that area would be very tender to the touch and painful. It also makes it incredibly difficult for you to continue breastfeeding, but unfortunately, one of the most effective ways of treating mastitis is to continue feeding, and I'm going to talk you through that. So, mastitis is most common in the first 2 to 3 weeks, but it can occur at any time in your breastfeeding journey. It usually comes on fairly abruptly and most often will only affect one breast. The symptoms would include a fever of over 38.5 degrees centigrade with chills and flu-like achy symptoms, and you might find that your baby is reluctant to feed from the affected side because the milk tastes different, and you might even see that it looks different, either that is a little bit stringy or lumpy, or it could contain mucus, pus, or blood, depending on how bad the infection is. Make sure that you are able to take rest, increase your fluids, and ensure that you are eating a good, healthy, nutritious diet. The 4 things you want to remember is heat, massage, rest, and empty the breast. You want to nurse frequently and empty the breast thoroughly, aiming for at least 2-hourly emptying of the breasts. If you're unable to breastfeed, then express either with a pump or with a hand expression. The other thing that's going to help a lot is heat and very gentle massage. And there's 2 ways that you can apply the heat, either by using a disposable diaper that you fill with warm water, squeeze out the excess water, and then just shape that diaper around your breast before an emptying session. Or you can submerge the breast in a basin of warm water with a handful of Epsom salts in that. Rinse it with fresh water before nursing because baby doesn't like the taste of the Epsom salts, or you can just stand in a warm shower and gently hand massage the breast, always towards the nipples, just to keep that milk flowing. Ensure that you wear a really soft and comfortable bra, no constriction or anything that causes more discomfort. And the very gentle massage will just help improve that milk drainage and improve your symptoms. Although we say you want to nurse on the affected breast, you might want to start on the unaffected breast until the letdown happens and then put baby over onto the affected side, ensuring that you've got a good position and latch in whatever position is most comfortable for you. You might find that using gentle breast compressions during a feed will also help to keep the milk flowing, or even leaning over to allow the emptying of the breast. And if you feel that the breasts have not been emptied adequately, then to pump or hand express afterwards, just to aid milk drainage and speed the healing. If you are in extreme pain, then use an anti-inflammatory like ibuprofen, and you won't need any antibiotics if the symptoms are mild and have been present for less than 24 hours. But if the symptoms do not improve within 24 hours, or you find yourself becoming more ill, fever getting worse, and the pain and area of redness and inflammation spreading, then it's really important that you get seen to get an antibiotic. And of course, it's always a good idea when you take an antibiotics, 1, to complete the course, and 2, to take a probiotic at the same time to reduce your incidence or chances of getting thrush. A cool compress between feeding will definitely aid in your comfort, and you can either use a cool cloth, cabbage leaves, or ideally silver mama nipple caps. Along with the cooling effect that they naturally bring, they also have antimicrobial, antifungal, antibacterial, and anti-inflammatory properties, which will aid the healing and preferably mean that you don't need to have antibiotics. Make sure that you are part of our WhatsApp community so that you can get answers when you need them and get your breastfeeding journey off to a good start.